I'm gonna just kind of look at you, and you can, once I do, you can kind of tell me if anything's going on with you. So what I was doing, I was just, as I described earlier, just kind of looking at her in a broad, almost blurred kind of way. And so I put a little pressure in the top of the head to see where she's leaning toward, and then I touched the area where I felt like that was, and I saw that visually too. What I saw was a little bit, the head coming forward a bit, and I could see that as an area where there's some stuff going on, but I also can see her kind of falling back onto her heels, and then it draws my eyes up into this area. So I kind of just went and pressed into it just gently, and just where she leaned towards, she was leaning toward mostly right in here, lower back area, and it's more back than front. I just could see it. Sometimes it's somewhere in between, but I could tell for her it was more in the back. Anything you have to say about it?
Yeah, I mean, my body holds on to a lot of tension and constriction. So especially in the low back, I've had lots of years of history with challenges there. I have learned that my IT bands tend to get pretty tight, and that helps to create things, but so much of my challenges, body, mind, and spirit, have settled around the root and sacral chakras, and around, security and trust, and but also my hips, even in my yoga practice or in my movement, my hips are the tightest part of me, and where a lot of things come out to surface. So,
yeah, and I can see that, just the way you're kind of wanting to fall back on your heels, especially the right one, it's kind of going, and I can just see it squeezing right here into what's called the sacroiliac joints. These joints right here, so I can see her kind of falling back.
Yeah.
And this is because this is compressing and it's pulling her that way.
And it's an area that's hard to create space if we're going back to that piece.
Yeah.
In my yoga practice, that's where I can't do too many forward bends, or I have to be very explicitly mindful about my movement in that area, and the right side tends to go out more than the left.
Right, and I can see, could you face the camera for a moment? Just stand normal, and the right leg and foot are just a little bit more turned out. And so I noticed that also, and that's the one you're kind of leaning back onto more, so that tells me that SI joint is gripping more, and most likely she's probably a little higher on her right iliac bone. Let me check that. Hook in onto those. And it is a little higher on the right. If you can see where my thumbs are, but the right one's a little bit higher. Let me check the back. Face this way. So I'm trying to get into those little knobs in the back called the PSIS.
Okay.
And it's a little higher in the back and also. So this is what's called an upslip. Sometimes the iliac bone can rotate. In this case, her right iliac bone is just slipped up, the whole thing. So it slides over the SI joint, sacroiliac joint. It also slides over the pubic symphysis here. This is one situation that oftentimes that correction can happen pretty quickly. A lot of this stuff, it doesn't mean it always stays forever. Should have brought a pillow. But I want to have you lie on your left side.
Okay.
So what we'll do first is I'm just going to work on lowering her right iliac bone by working with her fascia, and see if we can make that.
Face
Face that direction on your left side, the head up here.
Head up here.
Yeah. Sorry, I didn't bring a pillow.
That's okay.
I'm going to put this leg behind a little bit. So I'm just putting my lower hand on the iliac bone, My upper hand, just create a little slack. It's usually better to get it right on skin, but I can work these clothes like this too. I just don't want to lose the connection. So I'm going to sink in. Actually, I would start at nothing. I always try to ask the body, how can I help? I start at 0, meaning I'm not doing anything. Especially this is important. This is especially important for people who are really having a lot of pain. And sometimes if you go in and try to just do stuff right away, their body can resist and it can flare up. So, so what I'm asking, can I help? It's kind of pulling me in a little bit. So I'm just leaning down toward the table until I feel some resistance. And then I'm going to just start to open away from each other, open the hands away from each other until I feel resistance. I'm trying to like suction cup onto her skin so I'm not sliding on her clothes. I always make my body very comfortable. The more comfortable I am, the more effective this is. If I'm uncomfortable, it's going to transfer into her, just like when we're dancing. If you put 2 dance partners together and one's tense, they're not going to feel the communication. So I'm trying to be as relaxed as I can be, and comfortable as I can be. And all of a sudden I feel it, her body felt something just change. Just by me, I took a little bit of a breath, I softened. And I can feel her body also softening. Something we were talking about earlier with being aware of my body, being aware of their body, and being aware of both at the same time. I can feel just some subtle movement happening, a little bit going down toward her feet. I can feel that it just little subtle movements, kind of like taffy giving. So, even though it seems like there's not much going on, there's a constant movement happening, and I'm going with it. And actually, right as I said that, I can feel her right hip rolling a little bit forward. Do you feel that? Mm-hmm. And that's the direction it was rolled out, so it's just rolling forward. I'm not really trying to make it do that, but what I'm doing is I'm going with it. And I haven't really spoken about this today, but it's such an important thing is I'm listening to the body and working with her body wisdom. I guess I have talked about listening, but not body wisdom. Her body knows more than I know as a therapist, and I know that. So I work with that all the time. And sometimes people say, well, I'm interested to see what you do with this person, and I never know what I'm going to do. It doesn't matter what their diagnosis is. I didn't know anything about her. I just met her a little bit ago, but just by listening to her body, I was able to discover that she's got this upslip. She's got compression in her lower spine. That's the biggest thing her body's struggling with right now. And now we're working with it, and we're helping it to release. Her collagen is slowly releasing. We've had several, I'd say, relatively big releases, and a lot of small stuff going on. Sometimes I'll do longer than this, but I'm kind of just drawn to go to her leg and just traction her leg a little bit. And I don't always know why I do what I'm doing, except that it just feels right sometimes. Sometimes I can give it really great words, but I just got the sense that this would be helpful. And some of that's experience, and the biggest thing is just trusting what I feel. And I think that's one of the hardest things for people to learn, because we're not encouraged to do that much in the way we're educated. And it's such an important part of life, to trust what we feel. There's so many times where, there might be a person that you trust or don't trust, and there's a situation you're in, and And if you listen to it, it works out. When you don't listen to it, you think like, man, I knew I should listen to that. You know, and it's this, we all have these awarenesses, but we discount them sometimes. And right now her leg's just going, I'm just following her. Sometimes I'm leading and sometimes I'm following, just like in dance. I'm following it, and it's taking me down. That's why it's important to be strong and flexible, so you can go where people's bodies can take you.
Well, you were talking a lot about trust. I'm just jumping in. You were talking a lot about trust, and for me, like what's also surfacing is a willingness to trust you with my body, and like allowing you to actually take the weight of my leg is not a natural thing.
Yeah.
And it's something that's very deeply rooted in my story. So if we're talking about how everything is connected, the emotional component, like there's a tendency to cling and a tendency to not be willing to allow ourselves the tenderness of being open to another. And so like internally, I keep having to remind myself with every breath, like you can just let go. Like he's here to help. I do feel safe. I do trust him in that. But it's an internal process to like ease into that and to let go in that.
Yeah, and I can feel that happening. I can feel, for the most part, I can feel her letting go. There's moments where I feel the brakes go on, and that's very common. The brakes are like that part of saying, no, I don't feel safe, or I don't, it's not safe to trust somebody like this. You know, someone has violated me before, or something like that, you know. So, but I can feel her doing it and then letting go. And I'm going with it, and I'm listening. And a lot of times I do a little bit more structural, I mean, I am doing structural work, but her body's kind of unwinding a little bit. I mean, it's just, I'm going with it. It's telling me where to go. That always happens some, but the more someone has the brakes on, the less it happens. It's the harder it is to read, because they're blocking anyone from reading them. They're being safe, which has its benefits, and also has its what's the other word for that? The opposite. Detriments. There's like a little movement that just happened in the kind of in the side of her right gut area. Did you feel that? Mm-hmm. And that's, to me, that's like an autonomic kind of response. There's a fight or flight type thing going on a little bit, and it's just what she was talking about feeling safe. It's some of that coming up in her tissue, and sometimes in these kind of situations, it's a little more prevalent because we're all here focused on healing and awareness and being free. That's what this is about. This isn't about dwelling on painful things. This is about being free. And so inside of her, a part of her is recognizing that. She recognizes it through the feel, through the words that have been spoken today, but also through just the feel itself. The internal feeling, the felt sense. She's recognizing that, and a part of her is letting it go, and a part of her is putting the brakes on. Like, I don't know. And I can feel the brakes in moments. That's okay. It's not my job to tell people you have to let go. I just support people where they are, and I encourage it sometimes, you know, if you know, but it's all about listening. I'm just going to kind of go right to where that area was, and just not really have an intention necessarily right now. Sometimes I do, like I'm going to release the quadratus lumborum muscle. I'm kind of over that area. But when I felt that earlier, it wasn't really necessarily, it was near the quadratus lumborum, but it was actually a little bit more forward here. I could feel, like when I was pulling her leg, it's kind of like if you're wire skiing, you lean back on the rope and you feel the tension go out of the rope. I was just kind of leaning back and feeling that. Where did it go? It went right here. And so the body was telling me where it is precisely. I'm just, what am I over here? I'm just kind of asking what's happening in there. Just bring your awareness into that area and let yourself feel that area and sort of be inside there. If it feels okay for you to do that.
Yeah, there's also part of it that's like running down like deep into the hip. Like I can feel the lateral movement down.
Yeah. And right as you said that, like my fingers, they're kind of wanting to go, almost like walking like that. And earlier I kind of talked about the psoas, and I've seen whole books written about the psoas. It's such a, all 5 lumbar discs are attached to it. It attaches to the front of our hip, so it has a lot to do with lifting our leg, but also stabilizing our spine and stabilizing our whole body, because if our pelvis is out of alignment, if one hip's higher for me, what has to happen for me to be centered? My eyes are going to be level naturally. I'm not going to walk around like this. So I'm going to find a way to level my eyes, and what's going to be happening? A lot of weird stuff in my neck and shoulders and spine. So now I'm getting into her psoas now. Is that very tender?
I mean, it feels tender as in it feels vulnerable, but not tender sore.
Yeah, okay. So, ironically, almost anytime someone's got, yeah? Oh, I thought you were asking a question. Almost any time someone has a lot of lower back stuff going on, I almost always work in the psoas or check it out, because most of the time there's going to be stuff going on there. And ironically, as I do this, she's going to have relief most likely in her lower back. And you're like, how is that happening? But it really does. And part of what
it feels a lot more spacious.
Good.
But I also interestingly feel this connection through the whole of my body. So like from the top of my head down through the hips in a way that I haven't ever probably before.
Cool. You said, what is it, an awareness, or what do you know?
Yeah, I mean, I think just energetically, I can feel it a little bit in the muscles, but I feel this connection from the mind down through to deep in the hips.
Mm-hmm. Well, and some of it in a structural way, part of what that can be is our dural tube, the connective tissue that goes around the brain and spinal cord. It can feed into any part of the body. So we got these things called dural sleeves, the little sleeves that come off the spine, and they can connect it anywhere. And then our fascia itself too. It's kind of like if I'm pulling on my shirt and everything else is going like a 3-dimensional spider web, like a fly caught in a spider web. So it's very common for me to be working on one area, and then areas that seem very unrelated they have feelings there or something. Sometimes I can be working on someone's here, and they might feel it in their sinuses. There's no rhyme or reason to it. The things that we were taught in medical books exist, but they also don't exist. The boundaries don't really exist. We do have organs and we have muscles, but our muscles are actually uninterrupted from head to toe. I had a massage magazine that had this dissection of a cadaver where they did not cut away the muscle attachments the way they do when they dissect cadavers and they tease out muscles. And the muscles were literally uninterrupted from head to toe.
Well, I think so much of our lives we live, you know, from the neck up, and so actually feeling the interconnections in the body is something that's learned for me over many years.
Go ahead and roll face up. So I'm going to just bring your knees this way. I'm going to squeeze real tight. Instantly there was a pop.
Mm-hmm. Two.
Yeah, 2 pops, yeah. Good. So the movement we did kind of helped slide down into the bone. I'll do a little bit on, go ahead and rotate put your head on this side and stand behind your back. I'm just going to work on a little bit on the other psoas muscle. I would do a lot on the back itself also. Yeah. Just work a little bit on this psoas so we balance things out, because I know this one's also tight. I would all work on the lower back also, but we don't have time today. And there's a little bit more of that autonomic nervous response happening, a little bit of shaking going on inside. And you think about this area, it's really deep, and it's by our kidneys, which is, the kidneys represent, in a metaphoric way, they're the deepest organ. So you think about where they are, they're the deepest organ we have, and if we look at that in a metaphoric way, it's the deepest part of us is our sense of where we come from and where, you know, what's our purpose and those kinds of things. So maybe there's a struggle inside about that going on, about my creativity, my source, where did I come from, and sometimes when I work with people and they've had, say they recently had a parent die or something like that, I will always work on their kidneys then, because it's going to go there. Also the liver. The liver deals with grief and deep anger. So we just, certain things I just know is going to happen. But I wasn't really intending to work the kidneys, but the psoas and kidneys are right next to each other. There are techniques I would do with the kidney, but yeah, there's a lot going on right now. There's a lot, like there's a little bit of like vibratory stuff going on up in the neck. You feel that?
Mm-hmm.
Yeah.
This really throughout my whole body, but it's like, yeah. I'm almost like teeth chattering.
Right, and so in the beginning I was noticing how the head was really forward, and that was, to me, the secondary area. It was close, but not the same as the lower back area. So I'm just going to give that a little bit of support. Right now I'm inclined to just gently traction the head, just barely, because I just asked and that's what it said. I said, should I stay here? Should I go down or up? Compress or decompress? Decompress. So I went and decompressed. I'm decompressing, pulling the head slightly that way, not much, just the amount it's asking for. I'm conforming to it, like we talked about earlier, in the boxing video. I'm conforming to her head and becoming like water, going with it. Now the shaking is going a little bit down to the left leg. It's kind of throughout a lot. Yeah, she's breathing with it, allowing it to move through her. She's not resisting. There's degrees of it.
Well, and interestingly, like the pressure on the psoas, it goes from feeling tender, like it's a sore muscle, like he's hit, you know, a knot that someone's trying to massage out. It has shifted to being like there's no pain anymore. It goes from that sore tenderness to actually, I don't know, feeling like a part of me, I guess.
And I've been noticing a lot of rapid eye movement too. Kind of stopped when she started talking, but it's just, when our body is, sometimes we get what's called vasomotor responses, where areas get red. There's a little bit of that going on up around the neck and head area, and shakiness sometimes, rapid eye movement. And it's just the body's reorganizing. It's releasing some of this old stuff inside. And we're going to have to stop in a moment here, and that's okay. Her body, none of this will, if I stop at any time, it's not going to hurt anything. because this is all stuff that's just been in there for a long time, and it can always be released, and it never hurts anybody. It's good to have a sort of a sense of closure sometimes when you get stirred up inside, so we'll do that. What are you feeling?
Well, it was interesting to listen to you talk about I feel good in this moment. Definitely feels better in my body and in those areas. This is probably the most comfortable I've been laying on my back in a long time. But listening to you talk about the kind of things you were kind of referencing, that question of worthiness, the question of creativity, even the parent dying, like all of that is kind of in my awareness in this moment. So I can appreciate you sharing that as well.
And I never met her before, but this stuff is just it's just how we are. And this is, like I said earlier, when we think about like speaking a language, this is like speaking a language. It is a language, and I can't tell you everything about it in the time we do a video, but it's a process of understanding it and just taking the time to understand yourself. So what I'm kind of doing is just kind of sweeping the energy down her body, so when she leaves here, she's going to feel kind of grounded more. She's not going to feel but there's stuff going through, and I'm going to just encourage you to, if there's emotion that comes up later, just allow it to move through. Just think of it like a wave in the ocean, and just let it be, and don't judge it. Just let it move through your body, and it might have intense moments, and it'll turn into things. That's something I learned in an energy class I took. Just kind of sweeping the energy down the body. It kind of helps you feel a little bit grounded. Does that kind of help feel a little better?
Yeah, definitely.
Yeah.
Thank you.
You're welcome. And just with the lower back issues, it's good to kind of blow to your side and let your legs go off and push up, so you don't sit up and hurt your back after we just released something.
I'm normally very mindful that I didn't need
that
that extra support in this
awesome.
moment.
Right,
so
right.
Thank you so much.
You're welcome. All right, well, I'm glad you're done. You're welcome. All right, well, that was our therapy demo for today, and thank you all for joining me as we continue to discover how everything is connected.